One pain reliever lasts 12 hours. The other only lasts 4 hours. Both are sitting in your medicine cabinet right now. Both belong to the same family of drugs. But they work at completely different speeds. We're talking about ibuprofen and naproxen. Two medications that millions of people use every single day without knowing the crucial differences between them. You might be reaching for the wrong one. And that mistake could mean the difference between all-day relief and constantly watching the clock for your next dose. By the end of this video, you'll know exactly which one to grab from your medicine cabinet for every type of pain you experience. So stick around, because what we reveal might completely change how you manage your pain. Pain is universal. Everyone deals with it. Headaches, back pain, arthritis, muscle aches, dental pain, injuries. The list goes on and on. And when pain strikes, most people reach for one of two over-the-counter options. Ibuprofen, which you probably know as Advil or Motrin. Or naproxen, which is sold as Aleve. Both of these medications belong to a drug family called NSAIDs. That stands for non-steroidal anti-inflammatory drugs. They work on similar pathways in your body. But here's what most people don't realize. They are not interchangeable. Not even close. The differences between them affect how fast they work, how long they last, which conditions they treat best, and even their safety profiles. In this video, we're breaking down 8 key differences in speed, duration, effectiveness, and safety. Let's dive in. Difference number 1: how they work. Let's start with the basics. How do these medications actually work inside your body? Both ibuprofen and naproxen block something called COX enzymes. There are two types, COX-1 and COX-2. These enzymes produce chemicals called prostaglandins. And prostaglandins are responsible for causing pain, inflammation, and fever in your body. When you block these enzymes, you stop the production of prostaglandins. Less prostaglandins means less pain and less inflammation. Simple, right? Both medications are what doctors call non-selective NSAIDs. That means they block both COX-1 and COX-2. This is actually why they have similar side effects. They're working on the same biological pathways. Think of it like this. They're like two different keys that open the same lock. But one key turns fast and the other turns slow. Same mechanism, different speeds. Understanding this helps explain all the other differences we're about to discuss. Difference number 2: speed of action. Now let's talk speed. When you're in pain, you want relief now, not later. Ibuprofen is the speed demon here. It's fast-acting and starts working in just 30 to 60 minutes after you take it. You feel the difference quickly. Naproxen is slower. It takes about 1 to 2 hours to reach peak effectiveness in your bloodstream. That's double the wait time. So if you've got a sudden pounding headache, a toothache that's killing you, or menstrual cramps that hit out of nowhere, ibuprofen is your friend. It kicks in fast when you need immediate relief. Naproxen takes longer to get going. But here's the thing. That slower start comes with a major advantage that makes the wait worth it. We'll get to that in just a second. For now, remember this. Ibuprofen wins the speed race every single time. Difference number 3: duration of relief. Here's where naproxen gets its revenge. Sure, it's slower to start. But once it kicks in, it stays working way longer. Ibuprofen is short-acting. It lasts about 4 to 6 hours. Then the pain starts creeping back. You have to take another dose. That means you're popping pills 3 to 4 times a day. Every 4 to 6 hours like clockwork. Naproxen is completely different. It's long-acting and lasts 8 to 12 hours. You take it twice a day. Morning and night. That's it. Fewer doses means it's easier to remember. You're not constantly watching the clock. This makes naproxen perfect for chronic conditions like arthritis or ongoing back pain. You get steady, all-day relief. Ibuprofen is better for temporary pain that comes and goes. Quick relief but short-lived. The choice depends on what kind of pain you're dealing with. Difference number 4: dosage and amp. Strength. Let's break down the numbers. Over-the-counter ibuprofen comes in 200 mg tablets. Most people take 1 or 2 tablets per dose. The maximum daily dose without a prescription is 1,200 mg. With a prescription, doctors can go up to 2,400 mg per day. Naproxen sold as Aleve comes in 220 mg tablets over the counter. The maximum daily dose without prescription is 660 mg. With a prescription, it can go up to 1,000 mg daily. Now here's an interesting comparison. Equals roughly 400 mg of ibuprofen in terms of their approximately equivalent at those doses. But notice something important. You need a lower total daily dose with naproxen. That's because it stays in your system longer. Less medication overall but longer lasting effect. It's more efficient in that way. Difference number 5: what they treat best. Both medications treat a lot of the same things. Headaches, muscle aches, dental pain, menstrual cramps, minor arthritis, and fever. They're versatile pain relievers. Ibuprofen excels at tension headaches because it works faster. It's great for acute injuries like a sprained ankle. And it's approved for children as young as 6 months old for pain and fever. Parents rely on it constantly. Naproxen shines with arthritis. That longer duration means better control of joint pain throughout the day and night. It's excellent for chronic back pain and inflammatory conditions. Studies even show it works particularly well for gout attacks. Research suggests naproxen is slightly better for osteoarthritis, especially that nagging night pain that keeps people awake. If you need occasional quick relief, go with ibuprofen. If you're managing ongoing chronic pain, naproxen is your better bet. Difference number 6: side effects. Every medication has side effects. Let's be real about what these can cause. Both share common problems. Stomach upset, heartburn, nausea, and dizziness top the list. Both can cause more serious issues like stomach ulcers, gastrointestinal bleeding, and kidney problems. But there's a key difference. Naproxen has a higher risk of stomach problems. Why? Because it stays in your system longer. More time in your body means more time irritating your stomach lining. Ibuprofen is generally better tolerated for short-term use. Your stomach gets a break between doses. Both medications can slightly increase your blood pressure. Both can worsen existing heart failure. The golden rule for both: always take them with food. Food creates a protective barrier in your stomach and significantly reduces the risk of irritation and upset. Never take either on an empty stomach if you can avoid it. Difference number 7: heart attack and AMP. Stroke risk. This is critical information everyone needs to know. All NSAIDs carry an FDA warning about increased risk of heart attack and stroke. This isn't a maybe. It's a documented risk. The risk goes up with higher doses, longer use, and if you already have heart disease. But here's the important difference between these two. Naproxen appears to be the safest NSAID when it comes to cardiovascular risk. Has the lowest heart risk among all NSAIDs. Ibuprofen has moderate risk, especially at high doses like 2,400 mg daily. Low-dose ibuprofen up to 1,200 mg per day is relatively safe. If you have risk factors for heart disease, high blood pressure, previous heart attack, or family history, naproxen is generally the preferred choice. But regardless of which one you choose, always use the lowest effective dose for the shortest time possible. Don't take these medications casually if you have heart concerns. Difference number 8: age and AMP. Availability. Age matters when choosing between these medications. Ibuprofen is safe for children as young as 6 months old. It comes in liquid formulations that make dosing easy for kids. Parents use it constantly for fevers, teething pain, and childhood aches. It's the go-to pediatric pain reliever. Naproxen is only approved for children 12 years and older. It's not an option for younger kids. Both are available. You can walk into any pharmacy and grab them off the shelf. Both are also available by prescription in higher strengths when needed. Naproxen sold as a leave is easy to spot in stores. Ibuprofen has more brand options like Advil and Motrin. The availability is excellent for both. But if you're treating a child under 12, ibuprofen is your only choice between these two. Let's talk about your wallet. The good news: both medications are incredibly affordable as generics. That's dirt cheap. Naproxen runs about $8 to $15 for 100 tablets of 220 milligrams. Still very affordable. Both are cost-effective pain relief options that won't break the bank. And here's a money-saving tip. Generic versions work exactly the same as brand names. Don't pay extra for Advil when generic ibuprofen is identical. Don't pay extra for Aleve when generic naproxen sodium does the same job. The active ingredient is what matters, not the fancy packaging or marketing. Save your money and buy generic. Your pain won't know the difference, but your wallet will. Here's the truth. There is no universal better option. It completely depends on your situation. Choose ibuprofen when you need quick relief from sudden pain. Headaches, acute injuries, dental pain, anything that hits fast and needs fast treatment. Choose it for children. Choose it for occasional use when you just need something right now. Choose naproxen when you're dealing with chronic conditions like arthritis. When you need all-day relief without constantly taking pills. When you want fewer daily doses that are easier to remember. If you have heart disease risk factors, naproxen is generally safer. Consider the type of pain you have, how long you need relief, your medical history, and your age. Many smart people keep both medications in their medicine cabinet. They use ibuprofen for quick hits and naproxen for sustained relief. That's actually a great strategy. Now for the critical safety warnings you must know. Never, ever take ibuprofen and naproxen together. Doubling up on NSAIDs is dangerous and dramatically increases your risk of serious side effects. Don't exceed the maximum daily dose of either medication. More is not better. Always take them with food to protect your stomach lining. Your risk of stomach bleeding increases significantly if you drink alcohol heavily, 3 or more drinks per day. If you're 65 or older, your risk goes up. If you take blood thinners or steroids, your risk increases. Long-term use beyond 10 days requires doctor supervision. Both medications can mask fever from infections, which might delay important treatment. Stop taking them immediately if you experience black or bloody stools, severe stomach pain, chest pain, or sudden weakness. These are emergency symptoms. Neither medication is safe in the 3rd trimester of pregnancy. They can harm the baby. Both medications interact with other drugs you might be taking. They interact with blood thinners like warfarin. They can increase bleeding risk when combined with aspirin. They can reduce the effectiveness of blood pressure medications, which is a serious problem for people with hypertension. They may interact with certain antidepressants called SSRIs. Here's a specific issue with ibuprofen. It can interfere with the heart protective effects of low-dose aspirin. If you take daily aspirin for your heart, timing matters. Take ibuprofen at least 8 hours before your aspirin or 30 minutes after it. This prevents interference. The bottom line: tell your doctor about every medication you take. Every prescription, every over-the-counter drug, every supplement. Drug interactions can be dangerous. Your doctor needs the complete picture to keep you safe. Don't assume these common pain relievers are harmless. Let's recap everything we've covered. Ibuprofen works fast but only lasts 4 to 6 hours. Naproxen works slower but provides relief for 8 to 12 hours. Ibuprofen is your go-to for quick relief from sudden pain. Naproxen is better for sustained relief from chronic conditions. Naproxen appears safer for your heart but harder on your stomach. Both are effective when used correctly and responsibly. The key is always using the lowest effective dose for the shortest time needed. Remember, this video is for educational purposes only. It's not medical advice. Always consult with your healthcare provider before starting any new medication or if you have questions about what's right for you. If you found this information helpful, please hit that like button and subscribe to our channel for more medical education content. And here's our question for you. Are you Team Ibuprofen or Team Naproxen? Let us know in the comments which one works better for you and why. Thanks for watching, and we'll see you in the next video.